say about Parkinson's disease, support, and treatment. Are you ready to dive into the fascinating world of neurology and explore the latest research on this complex condition? Then let's get started. Let's give a warm round of applause to our first student presenter, Pranav Vijay, a sophomore at San Francisco High School. His focus is on the STEM field. As an aspiring medical professional, Pranav's presentation promises to be engaging and informative, reflecting his keen interest in medicine. Let's welcome him on the stage.
Hello, my name is Pranav Vijay, and today I'm going to be talking about how Parkinson's is related to other diseases such as Alzheimer's, and just give a basis of Parkinson's in general. Next slide. So, in order to understand Parkinson's, we must know how it originates from. This is due to neuron death inside the basal ganglia, a certain section of the brain that is used to provide dopamine and norepinephrine to the central nervous system. Furthermore, this regulates movement within the body. So, when dopamine and norepinephrine is omitted from the bloodstream, the central nervous system cannot operate as functionally as it can, and thus movement becomes much harder to do. Next slide, please. So, how is Parkinson's such a big issue in current society? Well, around 1 million people have it just in the US alone, with an outstanding 90,000 people getting diagnosed with Parkinson's each year. This is around 1 person for every 7 minutes. As you can see, this has been a problem since around the 1980s. As in 1983, there was around 2 to 3 people getting diagnosed with Parkinson's per 100,000. While now that number is almost quadrupled in size, being around 9 to 10. Furthermore, this causes a lot of money to be needed to help prevent and supply these patients with Parkinson's. This can be due to direct causes, which are the money needed to supply hospitals, research, and more, and indirect causes, which might be the loss of wages of these employees and giving out paychecks to these disabled people. Next slide, please. So what are the symptoms of Parkinson's? What makes it a deadly disease that it is today? The main symptoms are tremors, which are basically muscle spasms and shakings. This makes it harder for the body to operate. They'll have more rigid muscles and slow movements. A perfect example of this is the boxing legend Muhammad Ali. Muhammad Ali was diagnosed with Parkinson's after his outstanding boxing career, and now is hospitalized to a wheelchair. What's worse is that these two factors can contribute to the iconic Parkinson's slouch. The slouch is where it revolves around a bad posture involving weakened back muscles as well as face muscles, as it do from Parkinson's. Furthermore, the more involuntary and automatic movement changes are affected of Parkinson's as well. This can be breathing, looking, or even just eating. Such speech changes and writing changes are also affected. Next slide, please. So, I would like to consider Parkinson's as a job, not a simple task. Managing Parkinson's is much like a full-time job. You will have to take more effort to do any simple task if you have Parkinson's. Sitting on a chair will take much longer. Taking a shower will be a hassle. Any daily simple task will be exaggerated beyond capability. What's worse is that the loss of dopamine can actually make a person depressed, which will limit their role in society and the role they have to fill in maybe their family's job and career. And then you also have to pay around $2,500 each year just in medications to survive Parkinson's. And the best course of treatment, called deep brain stimulation, costs an outstanding $100,000 just to undergo. Next slide, please. So what makes this disease not curable? Well, it can be attributed to 3 main factors. Similar to other diseases, the symptoms are not the same within all patients. They're quite ambiguous. Such, there cannot be one type of medication to cure all of these symptoms as well. In fact, 15% of people who think they have Parkinson's have a disease called Parkinsonism. Secondly, diagnosis occurs in extremely fragile stages. For example, 96% of people who have Parkinson's or been diagnosed with Parkinson's are over the age of 50, where their immune system and body is not at the best quality to counteract these changes. Last but not least, we have not found a way to resolve the ongoing neuron death in the brain, making it much harder to cure Parkinson's. Next slide, please. So how is Parkinson's related to other diseases, as I mentioned before? Well, it's a neurological disease. Such, it will be related with other neurological diseases, the main being Alzheimer's. For example, Alzheimer's and Parkinson's both involve dementia, even though Parkinson's is not known for dementia. This involves a hippocampus degeneration, which is a section of the brain that is solely dedicated to memory. What's worse is that Alzheimer's affects more of the brain, while Parkinson's focuses on the basal ganglia. This can lead to similar symptoms and dementia, as I mentioned before. What's worse is that there's no cure for both of these diseases. As such, a stride in a cure to Parkinson's can also result in a stride in Alzheimer's. Next slide, please. So what are some more other diseases related to Parkinson's? So I was talking about Parkinsonism later, and this has hundreds of diseases which can be related to Parkinson's. The main four includes supranuclear palsy, PSP for short. This has similar symptoms of Parkinson's and affects the basal ganglia. The main difference is that this will impact involuntary movements much more. It will be harder to breathe, to see, and to just eat. Well, multiple system atrophy, MSA for short, is similar to Parkinson's as well. Neuron death here makes it so that more organs and liver's automatic immune system also fails. In fact, high blood pressure is extremely correlated with the disease, as well as others. This can be attributed to the fact of an accumulation of this protein called alpha-synuclein. As seen in this picture right there, it will surround itself in a neuron and thus dampen its capabilities. Lewy body inhibitions, or LBD for short, is another disease related to Parkinson's, but this disease has helped other Parkinson's have a better research to Parkinson's. In other words, basically, this disease is providing a leading cause of solving Parkinson's. For example, the Lewy bodies that accumulate in Parkinson's have been attributed to the fact that it causes neuron death, and as such, Lewy bodies can be maybe inhibited. These neurons can also be saved. Last but not least, we have a disease called corticobasal degeneration, CBD for short. This disease is attributed to the fact of a mutation in a protein called tau. This tau protein will flip and connect with other tau proteins to make these little bundles of this protein. These bundles of protein will be surrounded in the neuron, as seen there. All in all, these diseases share similar symptoms to Parkinson's and should not be taken with right care. Next slide, please. So what are the current treatments for Parkinson's right now? Well, Parkinson's, as I previously stated, does not have a cure. That does not mean it can be treated. For example, there are three main methods of treatments for Parkinson's. The first is medications. Medications such as levodopa can provide sufficient amounts of dopamine to the body. And medicines such as amantadine can help counteract the symptoms as well. Second are surgeries, main being deep brain stimulation, which involves a neurotransmitter helping the brain regulate movements against Parkinson's. The last is just healthy habits. Having a healthy diet and proper exercise will allow for a person to be more adequately adapt to counteract Parkinson's. Furthermore, mental health is also an extremely, especially weak, vulnerable thing in Parkinson's. In fact, people who go to support groups with Parkinson's are 70% more likely to not be hospitalized. Next slide, please. So, what is the future of Parkinson's? Will Parkinson's still be a ravaging disease 5 years in the future? The answer is a bit ambiguous. As of when I'm speaking, there's around 145 compounds that are being studied and used in clinical trials, FDA approved, that will be made its way into medications. And also multiple research methods that are also being used for medications as well. I will talk about the three main ones I have come across. Lewy body inhibition, as I mentioned previously, has been associated with Parkinson's for quite a while now. The accumulation of Lewy bodies has been shown to induce neuron death, and as such, someone can make an enzyme or something that breaks upon these Lewy bodies. Maybe Parkinson's can be cured as well. Gene mutation therapy is usually for the unfortunate amount of people that have Parkinson's genetically encoded in them. In a simple way, gene mutation therapy is removing the bad DNA, the DNA that encodes for Parkinson's, and replacing it with more helpful DNA. The last one is neurotrophic factors, which are actually associated with how a neuron works. In fact, neurons typically work better with neurotrophic factors involved. As such, some scientists have predicted that if you involve neurotrophic factors within the brain, Parkinson's could also be helped as well. Next slide, please. Okay, thank you, and this is my presentation.